Hello class, and today we're going to be talking about abnormal psychology. Abnormal psychology is a branch of psychology that focuses on the studies of behavior, emotion, and thought. Throughout this course, I learned a lot about mental disorders that I didn't know about, and even learned about myself. Suffering with obsessive compulsive disorder, I've come to realize that it's much more beyond the social understanding of cleaning, but branches into a spectrum of disorder. OCD is a type of anxiety disorder in which people who suffer from it have recurring, unwanted thoughts that make them feel driven to do something. Some people commonly misuse the term OCD in referring to cleaning. However, people who suffer from it have many different compulsions that range on a high variety of scale. Typically, obsessive-compulsive disorder is difficult to diagnose since the ranges of symptoms involved with other personality, anxiety, and depression disorders. According to the DSM-5 manual, which is the worldwide manual used in psychology, OCD can be diagnosed with the presence of obsession, compulsions, or both, which is entitled in the name. That causes urges or impulses that can't be subdued unless acting upon them. These types of anxiety don't just range in obsessive-compulsive disorder, but can be associated with many things. Anxiety is defined as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Now, we can all argue that we have suffered from anxiety before, yet we don't suffer from an anxiety disorder. Psychology explains anxiety disorder as a nervous disorder characterized by the state of excessive uneasiness, apprehension, which typically comes with compulsive behavior or panic attacks. However, with both anxiety and compulsions, there are ways to treat these disorders to limit the effects on social life. These can be conducted through medications, therapy, treatment, through psychiatrists, and some examples of these treatments are cognitive behavioral therapy, selected serotonin reuptake inhibitors, which are hormones, and support groups. These can teach people who suffer to do breathing techniques and other techniques to ease the mind during panic attacks or acts of obsession compulsion. Yet, abnormal psychology teaches beyond the effects of anxiety, but the effects of substance abuse and addictive disorders. To have an addiction is just like having a compulsion that leads one to do something. Addictive disorders can be classified into two main groups: substance abuse or disorder, and behavioral addiction triggered by emotional stress. Some people with addiction disorders know that they have the addiction, but are unable to stop it even if they wanted to. Maybe you have an addiction to coffee or cigarettes. Both of these you know you have and are unhealthy for your body. Now, over time, people with these disorders build up a tolerance and need larger doses for the same effects. Maybe you switch your coffee to an espresso, which has a higher amount of caffeine. Though, these may stop your social life from going on by taking a break to take a drag of a cigarette or to go to Dutch Bros and grab a coffee. This is also common with ADHD medications. With people who use ADHD, sometimes they have to get higher doses because they become used to the one that is lower. Yet, one can try to withdraw from these substances. It can lead to hallucinations, migraines, cold sweats, and pain. These can make it even harder to want to quit the addiction or substance use. If you or someone you love has one of these addictions, it's always best to seek medical help through coping with the withdrawal process and fixing the problem. However, there are other issues beyond impulsive anxiety disorders that the DSM-5 manual talks about. For instance, it talks about personality disorders. These are disorders subjected to symptoms of depression. The three subcategories of these disorders are suspicious, emotional and impulsive, and anxious, two of which I have explained before. Personality disorders are long-term and unhealthy. Treatments range from hospitalization to the therapies we had talked about and those support groups. These aid in helping personality disorders. Throughout the learning process, I learned a lot about disorders and abnormal psychology. However, I also learned a lot about suffering people go through during finding aid, especially the difference between criminal justice and rights to psychiatric care. Many people do not know that mental illness doesn't have an exact definition and varies between state to state. This becomes a major issue with dealing with involuntary care between people suffering from disorders. maybe with thoughts of suicide, people don't want to go into care, but your families and friends know that you have to go, so we send you there involuntarily so you can seek the help that is desperately needed, that you may not know that you need. The main issue, however, comes with people suffering that are indifferent in criminal justice system, stating that people with mental illness do not intend to harm others and should be tried criminally. This problem arises many times among the years and stand out in the case of John W. Hinckley, who attempted to assassinate Ronald Reagan, but ended up injuring James Brandy, a secretary agent. In his attempt, he admitted trying to impress the actress Jodie Foster, arising his aspects of mental illness. This gave Hinckley the prosecution of insanity for his attempt. The line between criminal justice and mental illness creates safety for those who cause harm to others, just like John Hinckley. Yet, this case arises many more times among the years between mental illness and criminal justice, including for Mark David Chapman, who shot and killed John Lennon. He had claimed that the book Catcher in the Rye was his reasoning for killing John Lennon. The court did not give Chapman a psychological analysis because he stated he did not hear voices and was sent to prison. But somebody who was obviously delusional about a book to kill another person would be insane, just like John Hinckley. So he was sent to prison. So what makes Chapman and Hinckley so different? And where is the line between criminal justice and civil rights divided? In order to pursue this indifference, it is highly important to define the term of mental illness universally so even people who aren't criminally claimed can seek help. When under certain states of mental health, you may not know that you need help. I learned a lot in my abnormal psychology course, from anxiety disorders to substance and addictive disorders, OCD, and changes to mental health that are dire in the United States. I hope I was able to help others and viewers like you to learn more about abnormal psychology and to seek help if you know of somebody that may need it. For more, thank you all for your support.